community is suffering greatly from COVID-19, physically, emotionally, financially. 1,529 residents in Columbus have been infected. 38 have died. 12% of our neighbors are unemployed, and many are facing food and housing insecurities. But thanks to the leadership and partnership of Governor DeWine and the steadfast effort of our neighbors, we have significantly reduced the rate of infection, spared our hospitals and healthcare systems from being overwhelmed, and we've helped to save lives. But the virus is still among us, and efforts to reopen must be based on the best science available. It is not business as usual, but I support the governor's thoughtful, measured approach to reopening the economy slowly and safely. We've expressed 5 areas of need to Governor DeWine before we contemplate reopening, and we've made great progress. We asked about greater flexibility and expanded access to testing. And just since our engagement, the number of tests statewide are going from 3,700 to 7,200 a day, with plans to ramp up to 15,000 and ultimately 22,000 tests a day just in the next couple of weeks. We asked for increased testing supplies and kits. Just last week, 1,000 kits were brought to Columbus Public Health for Dr. Roberts and her team to use with partners here in the community. We've asked for the encouraging and recommendations for all residents to wear facial coverings in public, because we know how important that is to protecting ourselves and our neighbors, particularly the employees on the front lines in our grocery stores, our pharmacies. We wanted clear, consistent guidance on mass gatherings throughout the state, and the governor has assured us that they will remain in place for the foreseeable future. We also asked for clear guidance and support on managing, testing, containment, and mitigation of COVID-19 at long-term care facilities. Dr. Roberts has shared with me that there has been a comprehensive plan that's been developed by the Ohio Department of Medicaid and the Ohio Hospital Association for doing this work moving forward. If you listened to Governor DeWine yesterday, you know we've made great progress on all these fronts. We will be reopening the city slowly as we continue to monitor infections. Any business that is open, whether they have been open over the last several weeks or will reopen in the days to come, must follow stringent guidelines on social distancing, proper hygiene, cleaning, and face coverings for employees and customers. Let's go through the timeline. On May 1st, dentists and veterinarians can open elective medical procedures that don't require an overnight stay. Those can resume. On May 4th, construction, distribution, manufacturing, and general office environments can reopen or continue. On May 12th, consumer, retail, and other services can resume. But let me reiterate that these businesses can only reopen or resume only if they meet the stringent guidelines of safe distancing, proper hygiene, and facial coverings. I also want to remind everyone that the stay-at-home order remains in place. We strongly encourage all residents to only leave home when absolutely necessary. That restaurants and bars are not reopening for dine-in. And mass gatherings of more than 10 people are still prohibited. As we move forward in safely opening our community, we will continue to monitor the spread of COVID-19. We all have a role to play in keeping our community safe, and I ask all Columbus residents to do their part and act responsibly. I'd now like to ask Dr. Roberts to give us her latest updates and talk about why the 5 elements of our plan are so important to making sure we open safely here in the city. Dr. Roberts?
Thank you so much, Mayor Ginther, and good morning, everyone. Since before the first case of COVID-19 was identified here in Columbus, we have been working in tandem with Governor DeWine, Dr. Amy Acton from Ohio Department of Health, as well as with Mayor Ginther to protect the health and safety of everyone in our community from this virus. Thanks to their leadership, as well as the collaborative efforts of our community, especially all of you in the listening audience, of your resolve of all of our residents to practice the guidance, to stay at home and only go outside for those essential duties, to wash your hands, and really avoiding contact with other people. While we've seen the curve flatten over the last few days, this virus still remains a risk for our community. It's a highly infectious disease that we all need to be on guard for moving forward. We need to continue to be very vigilant and fight against it. Again, we must remain cautious while we're fighting against this virus. And as we've seen over the last few weeks, it didn't come to fruition the way it could have. And that's all due to the efforts of everyone in our community of practicing that social distancing, avoiding large gatherings, not having large gatherings, and only going out for essential duties. As a result of that, our hospitals did not see a surge in cases, whether it be to their ER or in their intensive care units, and we did not see widespread transmission in our community of COVID-19. But as the mayor said, in order for our community to reopen, there were 5 things that we really wanted to see from the state. And fortunately, we have seen many, if not all of those. We said we needed more testing and more swab kits. We needed clear guidance of how to handle mass gatherings. We needed some guidance of about face coverings or the wearing of masks. And we also needed some guidance and support of how we manage congregate living settings or long-term care facilities. We've seen in the last few days and even in the last few weeks that the state has come through with many, if not all, of those requests, and we appreciate that. Protecting our community is a multi-layered approach that comes from the state down to the city, and then we all work together to make sure that we're protecting each other. We have been consistent with the governor and Ohio Department of Health on the stay-at-home orders, as well as the gradual reopening of our state. That's a science-based and a data-based approach. We will continue to work in conjunction with them on this gradual reopening as outlined by the governor yesterday afternoon. During this time, Columbus Public Health will continue to do what it does best, which is to protect the health and safety of everyone in our community. It's the key role, and we're going to play a very key role in this response and reopening moving forward. I want to walk you through 3 things that Columbus Public Health will continue to do and will increase our efforts over the next few weeks as Ohio and Columbus reopens. First, we're going to continue with our case and contact investigation. And as the governor described yesterday, that contact investigation is going to be really critical for reopening Ohio. Right now I have a team of disease investigators who contact every case that's been identified by a lab here in Columbus as well as in Worthington. We interview that case and we get as much information as we can from that individual about potential exposures and who they could have been exposed to, and we get a list from them of their contacts. My team then reaches out to those contacts, and for every case we usually have 4 to 6 contacts that they've been exposed to that we then need to quarantine and contact that person, ask them if they had any of the symptoms, and ask them to quarantine for the next 14 days to make sure that if they do develop those symptoms, they limit their exposure to others. That work will continue, and it will likely grow as we start to test more individuals in our community. And as individuals in our community go out and about and either go back to work or do some of their daily activities, those numbers will likely increase. The second that we're going to continue to do is surveillance. We look at ER reports, EMS runs about respiratory disease activity in our community. We also look at the sale of over-the-counter medications about respiratory diseases or fever-like illness. We will continue to do that, and we will continue to post our weekly report to our website that looks at the number of COVID-19 cases as well as what we call syndromic surveillance that we will share with the community. It will be valuable for us to monitor where we are in this outbreak and if we're seeing a decrease not only in our cases but our syndromic surveillance activity. And third, we will continue to conduct business inspections to ensure social distancing is followed. That's going to be critical moving forward as more businesses start to open in our community. We want to make sure that the employees working there are safe, but any individuals that come in for business are also safe. And thus far, we've conducted 495 joint inspections with Columbus Police and 112 compliance checks for licensed facilities. And we've issued 29 warnings to date. We anticipate, again, as business starts to reopen, we're going to see more of a need for these type of inspections as well as education in our community. So I just want to re-emphasize how important it is for us to have this collective response to the COVID-19 outbreak. It's not just Columbus Public Health, it's not just the mayor and our elected officials. It's all of us coming together, working together to protect ourselves, to protect our loved ones, and to protect our community. So as we start to reopen Columbus, I would encourage you to continue to follow the stay-at-home orders when you can. Only go out when necessary. If that means you have to go to work, do that and come back home. Go out for your essential duties. And when you do go out, you should wear a face covering. Again, it's protecting others around you so that you don't spread this virus, because we know there is asymptomatic spread. And to keep the gatherings, the family gatherings, just to those that live in your household, and not participate in any extracurricular activities at this time. So I thank you for all that you have done thus far to help our community get to where it is today, and I encourage you to continue to help us do that moving forward. Thank you so much.
Thank you, Dr. Roberts. And before we move to questions from the press, I just think it's important for us to walk through why these elements are so important. These are important steps for us as public officials, public health leaders to take, but also for the public. That testing and contact investigations or tracing that you talked about. Talk about why that is so important until we have a vaccine, and then maybe talk a little bit. I know I've got a homemade face covering here with me of my daughter's beloved Ohio Bobcat mascot. But why these are important, because I still think we have to do an awful lot of education around these face coverings, why they matter, how we can protect our employees and shoppers as the economy starts to slowly reopen. But testing, contact investigations, tracing, and why these face coverings matter.
Sure. So thank you for asking that question, Mayor, and I'd be happy to talk about case and contact investigation. And as the governor said yesterday, this has been the foundation of public health. We do case and contact investigation for a lot of diseases, so we're very familiar with this. And it's important because it allows us to contain and prevent the spread of the disease as quickly as possible. One, by identifying the case with more testing, as you described. The more people we can test, the more cases we can identify. Once we identify that case, we isolate that individual. Isolation is for ill individuals. We tell that person they need to stay home until their symptoms resolve, and then once their symptoms resolve, they usually need to wait another 3 days or more before they can go out and interact with the general public or even with their family and household contacts. Then once we get the list of contacts they've had, so individuals who they could have exposed while they were sick or even before they were sick. We know that individuals can shed this virus up to 48 hours before they develop symptoms. So when we interview the case, we ask them, who were you exposed to 48 hours before your first symptom? We get a list of those individuals, and then we contact them and we ask them to quarantine themselves for 14 days. That again is another layer of protection for our community, because we're now removing those individuals who could be spreading the virus. We remove them from our community so they're not spreading it to others. It's a very efficient and effective way of reducing the spread in our community, and we will continue to do that moving forward. But the first step in all of this is the testing to identify the case. Once we identify the case, then we can identify the contacts and exclude them from interacting in our community. You bring up the face mask, and the face mask, although I know they're intrusive, they're not comfortable for many people, they're very, very effective in the spread of this virus. And as we continue to try to reopen Ohio, we need to do whatever we can as we're going about those essential duties, whether it be work, grocery store, or doctor's office, to reduce the spread of this virus. As I said, people can shed the virus up to 48 hours before they even develop symptoms. In addition to that, some individuals can be what we call asymptomatic carriers of the virus. They could have the virus, never ever have any symptoms, but yet they're shedding the virus and could share it with other people. So by myself wearing the face mask, I'm preventing the spread of the virus in case I'm one of those asymptomatic carriers. And if I'm wearing it around the mayor, if the mayor is wearing a mask, in addition to me wearing a mask, that is a barrier for him so that he cannot get the virus that I could be shedding. So it's important for both of us to wear a mask. Me as potentially the asymptomatic carrier, so I don't shed the virus, and then the mayor as a healthy individual so he doesn't get the virus. So again, it's very, very effective, and it's important for everyone to wear a mask when they're around other individuals, especially when they can't guarantee that 6 feet of distance between them and the other person.
Thank you, Dr. Roberts. These face coverings are just so important. I think we have a lot of work to do in educating the public and having them understand the value of this. Obviously, you can make these at home if you're able, and we'll provide additional resources on where folks might be able to access these face coverings and masks and give some guidelines on making those. We'll make sure to share that through the city's website or through CPH. And I want to thank Kroger for stepping up and requiring this even before the governor's announcement yesterday, because they want to make sure that the health and safety of their employees and their customers remain a top priority, and want to encourage other business leaders in this community to step up and follow Kroger's lead. Thank you, Dr. Roberts, for talking a little bit more about that. And at this time, I'd like to open it up for questions from the media. If you would just come forward to the podium, introduce yourself and your organizations, and Dr. Roberts and I will do our best to answer your questions.
Hi, Mayor Ginther. Hi, Dr. Roberts. I'm Sierra Lucas with ABC6. Along that same topic with masks and face coverings, we're wondering if this requirement will be policed in any way in businesses and stores. We've already seen some stores turn away customers who don't have those facial coverings. So if this requirement is going to be policed, what is that process like, and what is the penalty if someone doesn't have one? Thank you.
Well, I'll let Dr. Roberts talk a little bit more about how enforcement will take place from the local health department's perspective. But to your question, and thank you for your questions, we do believe that it is going to require leadership from business owners and business leaders to step up and make sure that their employees have these face coverings and these masks to protect them, but also requiring folks that are coming into their stores. I mean, the best way for us to have the greatest benefit, there is no way we're going going to be able to enforce, in every shop across the city. We really need the leadership, continued leadership of our business community, and that's why I gave the acknowledgement to Kroger for stepping up in a big way. We need folks like Kroger to step up and require this, provide face coverings to their employees, and require that folks that are coming in to shop at their establishments be protecting themselves and our neighbors. But I'll let Dr. Roberts talk a little bit about enforcement.
Sure, and I would just echo what the mayor said. I mean, it's going to be important for businesses to protect their employees. They want to make sure they have a healthy workforce, so asking their employees to wear the face mask, and then the expectation is their customers would wear it too. Again, that's another layer of protection for everyone. They're trying to keep their customers as well as their employees healthy. In terms of the enforcement process, we will continue doing what we've been doing, which when we get complaints from businesses from our line at 645-1519, we go out and we investigate. We look to see if the complaint is legitimate, and we often go out with Columbus Police. The first time we go out, it's education. We explain to them what the expectations are or what the rules are from the state. If we go back again and they're still not compliant, then we would give a warning and tell them that they need to cooperate. And then if we go out a third time, that's when we would go with guidance from our city attorney's office and we can cite them. Again, that would be the process moving forward that we anticipate. We also know that with more businesses opening up, since we've seen previously over the last 6 to 7 weeks, there will be more work for us, but it's going to be an important part of our reopening and making sure our community is healthy and safe.
Kevin Landers, WBNS 10 TV. Dr. Roberts, how many more people do you think you'll need to do effective contact tracing? And we're also getting concerns from dental offices, especially dental hygienists, who worry that they're being sent back to work without enough PPE. What's your recommendation to workers who feel they have to choose between going to work and their health? Thank you.
I will take your first question first, which is how many more staff do I think Columbus Public Health will need in order to do the contact tracing? I'm fortunate, we are fortunate in this community that I have a force and I can pull people from different areas in order to assist us with this. As of yesterday, I had approximately 70 staff working on this. The state says we should have anywhere between 10 to 15 staff per 100,000 population. If I take the population of Columbus and Worthington together, that's about 900,000. So it means I need about 90 individuals at a minimum to effectively do this. So with my 70 that I had, I pulled 9 more staff yesterday. We condensed 2 of our clinics to operate as one clinic as opposed to 2 separate clinics, and so I was able to do that. And then I'm also working on a partnership with our Columbus City school nurses to bring in additional staff. So to answer your question, I need, from yesterday, I need about 20 more, but with the consolidation of my 2 clinics and the partnership with Columbus City Schools, I feel confident that I'm going to have enough staff to help us respond effectively to our contact investigations. Your second question about PPE and staff being asked to go into environments where they don't feel safe. As the mayor said, I do believe it's up to the business owner to protect their employees and to provide them with what they need to be safe. If businesses like a dentist office needs assistance with PPE, there are resources out there. They could contact Franklin County EMA for assistance to see if they can help. And it might be in their best interest to wait until they have all the supplies they need before reopening, because if they reopen and they don't protect their staff, they could find they're going to have sick staff calling out, and then they're not going to be able to be open to provide the services they need to provide for their customers. So I would encourage the business operators to do what's right and best for themselves and their employees.
The only thing I would add to your question, Kevin, is although the city has a hiring freeze in place, we've been very clear with Dr. Roberts and her team that any additional staff that she needs for an appropriate, thorough, and comprehensive COVID-19 response, those staff will be made available to her. And we do have some additional resources now through the CARES Act that we are able to dedicate at this point to COVID-19 response, and working with Dr. Roberts on any additional resources she may need, particularly as we ramp up contact investigations, tracing, and doing our very best to expand testing as a partner to the state and local health providers.
Ginther and Dr. Roberts, Dan Perlman with NBC4. As parents head back to work, childcare is likely to become an issue for those parents, especially since there have been no changes to daycares here in the state. Does the city have any plans to help those parents, or do you have any advice for those parents if they decide that they have to go back to work and they have to make a decision between childcare and going back to work?
It's a great question, Dan, and I know that this is going to be a great challenge for us, and it's one of the things that I've raised with the governor directly and personally, that we have so many employees that make our companies go and make the great organizations in Central Ohio go, that have children that need care and guidance, and particularly with K through 12 education remaining only through distance learning through the rest of the year. And we understand this directly in our household. We have a 9-year-old, and so it is a big challenge for families. And as we contemplate even this summer with respect to summer programming, again, we're going to follow the lead of our public health experts, and Dr. Roberts is working with Recreation and Parks and the rest of our teams to think about these offerings this summer, what those look like, what can be offered in a safe environment, and what types of staff and other resources are we going to have to dedicate to make sure that that can be done safely. I will tell you that I've been in contact with Dr. Dixon at Columbus City Schools, and we'll be meeting again next week to figure out what other ways that we can help provide some resources to students within Columbus City Schools. But those children that aren't of school age, that aren't engaged in ongoing distance learning through a public school district or school, those kids birth to 5, it's something that we have to continue to work on, and at this point we don't have an answer until we have additional guidance from the governor, and we're contemplating resources on a local level to support those families at this time. Dr.
Yeah, so I would just add to what the mayor said, that in the governor's address yesterday, he was very clear that if you have been working at home and you can continue to work from home, you should do that, and your employer should allow that. That will help ease some of the burden for some of our working parents, but it's going to be a challenge. And again, this is a marathon, not a sprint. So we need to prepare for not only May, but as the mayor said, the summer programs. And we've been thinking about what does that mean for our community in terms of summer programs that we rely on for a safe but an active means for our kids to be engaged during the summer. So we're going to all need to work together and think creatively about what we can do, not only to bring our workforces back in an effective manner, but also to protect our children.
So one to add on there that we've been talking about is, as you know, there have been these frontline care centers for frontline workers, healthcare workers, folks that have been part of our first responders during our crisis here. And one of the things we may very well have to consider, particularly as more folks have to report back to work that can't work remotely, as Dr. Roberts mentioned, might be an expansion of that effort to make sure that there are enough child care spots available to workers here in Central Ohio. But I want to echo what Dr. Roberts said. It's really, really important for our employers to continue to lead. Our employers here in Central Ohio have been fantastic about flexibility with their employees and supporting them during this time, and this is a time where we've got to continue to do that. We're all in this together, and it is not going to be over anytime soon. Returning to normal it will not happen until we have a vaccine and widespread on-demand testing and rampant contact investigations and tracing. So I just ask everybody to stick together. We're all in this together, and ask our employers to continue to lead the way.
Mr. Mayor, Dr. Roberts, Ted Hart from NBC4. Two questions for the mayor, and each the question of home rule. I guess I'm wondering whether the city, should it decide to be more or less strict with its guidelines with regard to the reopening of businesses, can it do that? Could you be more strict or less strict? And for Dr. Roberts, the issue of restaurants, you talk about the restaurants themselves or the businesses themselves being leaders in this. The Restaurant Association says that its members are ready, that they all have been preparing for reduced occupancies, they've been preparing for increased sanitization and whatnot, and that they can be ready to go. I guess from a public health perspective, what is it that you need to see from restaurants or hear from restaurants in terms of giving them the green light to reopen?
Take the restaurants question first, and I'll take the other question.
Sure. So thanks for that question, Ted. And there are many people in our community that want the restaurants to reopen. But I think, we have to take this in stages. We have to be able to see what it's like when we open some of our businesses. And we need to be in a position where we can test more individuals. And so I'm optimistic that in the coming weeks, that as we bring more testing on board, as well as we start to see other businesses open up and people come together, we'll have a much clearer picture and understanding of this virus in our community, and so that the restaurants can open up, but most importantly, as you said, open up safely, not only for their employees, but for their patrons.
And Ted, to your first question, yes, we do have the ability to issue orders. I think there are 8 public health districts in the state can issue their own health orders, Dr. Roberts. And it's one of those things that we've contemplated since the very beginning of this crisis. Quite honestly, when the governor and I and Dr. Roberts and Dr. Acton were contemplating about what to do regarding the Arnold Classic, initially we were going to issue a CPH order for the facilities within the city of Columbus, and the governor was going to issue one for the fairgrounds and those under control of the state. What we decided at that time was that it was really, really important because we knew what was ahead of us. Dr. Roberts and Dr. Acton had been able to help the governor and I understand what we would be facing in the weeks and months to come, and we thought consistency and clarity guided by the state was the most important. We still believe that to be the case, but we continue to push the state. The 5 areas that I updated on earlier came directly from Dr. Roberts and her team at CPH, and the governor and his team have responded in making pretty significant progress in the last week or two in the 5 areas that we've been pushing. And so we have confidence that they will continue to help us meet this challenge and deal with this health crisis, a human service crisis, before we can contemplate and build our recovery in Columbus comeback. But I believe that our goals are the same as the state's. But we do have the authority, and ultimately, if we believe that the state is not honoring health and safety first, we do have the ability to go above and beyond. But I believe strongly that the governor and his team and Dr. Acton are continuing to lead the way, and I think consistency and clarity for across the state is very important as we battle this virus.
Hi, Sierra with ABC6 and Fox 28. We've already seen plenty of summer cancellations for events, but we're still waiting to hear about what decision will be for this summer's Red, White, and Boom 4th of July festival. Has anyone come to a decision for that?
Thank you for the question. We have not come to a decision yet, but as you can imagine, if we are wanting people to gather in groups larger than 10, that 800,000 of our closest friends, somewhere between 500,000 and 800,000 folks to come down to be part of one of the greatest fireworks displays and celebrations of our independence as a country in downtown Columbus. Obviously, there are going to be some major concerns around health and safety based on the impact this virus is having. No final decisions, but we're going to be putting the health and safety of Central Ohioans first in all the decisions that we make. And it won't just be for Red, White, and Boom, but other great events during the course of the summer. It'll be health and safety first as we make those determinations. Any other questions? If not, thank you all for joining us here today, and Dr. Roberts and I will be back to give additional briefings in the days and weeks ahead. Thank you so much.
Columbus Mayor Andrew Ginther talking about how he plans to reopen Columbus. First, some of the numbers. He said there are 1,529 coronavirus cases in Columbus and Worthington, and that 38 people have died. 12% of the population, he said, is now unemployed. He said efforts to reopen must be based on the best science available, and he supports the governor's approach to reopen the economy slowly and safely. As we have reported, Mayor Ginther wanted 5 things from the state, including more testing and for everyone to wear masks when in public. Ginther said the governor told him the ban on mass gatherings will continue for the foreseeable future. You just heard the question about Red, White, and Boom from our Sierra Lucas. Ginther said he'll reopen the city slowly while monitoring infections, and he's going to follow what the state is doing. May 1st, health procedures that don't require an overnight stay can resume, along with dentist's office, veterinarians. May 4th, offices can open, and then May 12th, consumer, retail, and service businesses can resume, but only with safe distancing, proper facial coverings, and proper sanitation. City Health Commissioner Dr. Myshika Roberts said her office will be focusing on 3 things: contact tracing, surveillance of what medicine people are buying, and they'll conduct business inspections to make sure proper protocols are being followed. She also said it's up to the business owner to provide employees with the PPE that they need to be safe. What about daycares? Well, Ginther said he doesn't have an answer. He said it's going to be a great challenge, and he may reach out to see if the number of pandemic daycares can be expanded. They're the ones who are taking care of the kids of the first responders. He said he's going to follow the lead of health experts and talk with Recreation and Parks about what kids can do this summer. Ginther said he's meeting with Columbus Public Schools next week to see what else can be done. He said the city's not ready to reopen restaurants at this time. And again, you heard the decision on Red, White, and Boom hasn't been made, but Ginther said the health and safety of all Ohioans will be put first. Stay with ABC 6. We'll have a complete wrap-up coming up at noon. And also make sure you have the free ABC 6 News app to get instant alerts the moment we get new information. We'll see you at noon.